Hi, and welcome to this webinar on equine asthma. My name is Charlotte Faslow. I'm a veterinarian with Boehringer Ingelheim in the Nordics. During this webinar, you'll have the opportunity to ask questions that we will answer in a Q&A session afterwards. Today I'm here with Professor Scott Perry from the University of Edinburgh. Scott has more than 20 years of experience working with equine inflammatory airway disease. So, welcome, Scott. Thank you for joining us.
Thank you.
Maybe you could start by telling us a little bit about how you got interested in working with equine asthma.
Okay. Well, I joined the university in the early 90s, and I've pretty much been there ever since. And as a young clinician, one is encouraged to embark upon a research component of their work. And at that time, Edinburgh had a long history of investigation of equine airway disease, which started off in the 1970s and then continued through the 80s. And then I embarked upon my PhD studies in the 90s. And so it was a natural progression for me, and one which I certainly have no regrets following. Yeah.
Okay. Today we're going to talk about equine asthma. Why do you think this is an important disease to focus on?
Well, I think I've come up with four points that came to mind in response to that question. Firstly, I think is prevalence. As we'll maybe discuss later on, equine asthma is an all-encompassing disease of the lower airways. And when we look at the prevalence of different forms of the disease, then it can be very high indeed, up to 80% in some cases. So I think when one has a prevalent disease, then it's important to investigate that further and understand it better. The second reason would be the welfare component of the disease. And we're really referring here to the severe form of equine asthma, where I think there is certainly a welfare component in horses that are putting a considerable amount of effort into breathing. And if we can ameliorate that in any way, then that's obviously improving the welfare. Again, going back to the more mild form of the disease, then there's convincing evidence now that it does have a significant impact on performance in horses that are sports horses. And then finally, with the new nomenclature of the disease, referring to the disease as equine asthma, then I think there is still probably an element of confusion regarding the definition of asthma and the terminology that we use in that disease. So I think from that point of view, it's worthwhile investigating a little bit further and clarifying those points. And I guess one last point would be the comparative aspects. There's an increasing body of work coming out now that has shown that the horse has quite a lot to offer with regard to human asthma. And I'm thinking mainly about the work on remodeling in equine asthma that has come out of the group in Montreal. So a lot of that has direct translational application to people. So there are a number of reasons why I think it's an important disease. Okay.
And as you said, equine asthma is a fairly new term that we use to describe diseases that we've actually known for many years. So yes. Just to be clear on what we're talking about today, could you maybe define equine asthma for us?
I will try. So as you alluded to there, equine asthma is a all-encompassing umbrella term that we would use for a number of diseases which up until now we've had a tendency to try and pigeonhole as specific diseases or syndromes. So I've defined it as best I can in this slide here, and I'll just go through the wording. So I've defined it as a non-septic lower airway inflammatory disease with varying degrees of airway obstruction and hyperreactivity, and that it's induced by airborne environmental exposures, and it's reversible following, certainly clinically reversible, following avoidance of those inciting exposures. So that's how I would define the disease in simple terms. I can go a little bit further there with regard to the definition. I've already alluded to the fact that the use of the term asthma, I think, has to be justified partly with regard to people's understanding of that term. And in human medicine, obviously, the term asthma is quite widely understood and comprehended. So if we're going to use that term in horses, then obviously there has to be similarities with the human disease, otherwise it causes more confusion. And what I have in this slide here is a definition of human asthma, with regard to the global initiative for asthma. This is how they would define the disease. But bearing in mind that human asthma is a heterogeneous disease, there's a number of different subforms of asthma. So this is really the kind of minimal inclusion criteria for that particular disease. And those include chronic airway inflammation, a history of respiratory symptoms, which are highlighted there, variable expiratory airflow limitation, again, which is importantly reversible, either by the use of drugs or change in environment, airway hyperresponsiveness, so that would be the clinical phenotype of the disease. With regard to the pathology, it's defined by bronchoconstriction or airway narrowing, airway wall thickening, increased mucus production or decreased clearance, and remodeling. Now, what I've done in this slide is I've highlighted in red the features, both the clinical and the pathological features that the horse has in common, so equine asthma has in common with human asthma. And those in red relate to the severe form of the disease and the mild to moderate form of the disease in the horse. Those in blue perhaps are more in line with the severe form of the disease. So we have their history of respiratory symptoms, which includes wheeze. Wheezes are something that we would appreciate usually during auscultation of the chest only in the severe form of the disease because it reflects the severity of airway narrowing. And remodeling I've highlighted in blue as well. But in saying that, there is recent evidence to show that remodeling does occur in the mild to form of the disease as well. And those that aren't highlighted are clearly symptoms, human symptoms that rely on a perception, so a shortness of breath, a chest tightness, that these are obviously criteria that we can't assess in the horse. So I would say there's ample evidence that the disease as we define it in the horse has many, many similarities with the disease in humans. So one justification for using that term. We talked about the mild form of the disease. Now, oftentimes when we think about asthma, we're going to think about the severe form of the disease, a horse that has trouble breathing. But we defined it as an inflammatory response to inciting airway exposures. And these are just two graphs from publications that highlight this fact. The one on the left is a publication from Michigan, from Sue Holcomb. And that clearly shows along the x-axis there, we can see the different cell types within the airway of the lung. I'll just highlight those along here. And the one we're interested in is the neutrophil here. So this would be the effector cell in a lot of cases of airway inflammation in response to dust exposures. And here we see the percentage of those. And the black columns are the ones relating to the horse when it was at pasture, and the coloured columns are those when it was stabled. And we can see there when a horse, these are healthy horses, these aren't horses that are susceptible to severe asthma. When they come in from the pasture into stabling, there's an inflammatory response in the airways. This was also shown, we can see on the graph on the right-hand side. So again, this is looking at airway neutrophils and mucus scoring in both healthy horses and horses that are susceptible to heaves. And we can see again, following stabling, so this is a timeline following stabling here, and this is work out of Switzerland by Vince Gerber, that in both groups of horses, we have an increase in mucus and we have an increase in airway neutrophils. It's just that the severe form has a more significant elevation. So this isn't a disease that is only applicable to the severely dyspneic horse. Again, just following on from that, these graphs show that exposure, so those other pieces of data related to horse going from pasture onto stabling, but these two graphs here show that exposure or response to exposure to dust seems to be dose dependent. So this is some work out of Michigan, again from Millerick May, where they were looking at exposure to PM10, so this relates to particle size, and airborne exposure to PM2.5, so again, a smaller particle size. These are particles that are going to get down to the small conducting airways and beyond. And the little circles with the arrows, or the triangles in them, these reflect to the percentage of horses, or the proportion of horses that had a mucus score higher than or equal to 1. And we can see there that mucus score seems to relate in those different stables to the PM10 exposures. In actual fact, the neutrophils in the airway related to the PM2.5 exposures. So again, it's not an all or nothing response. This seems to be a dose-dependent response to exposures, which I guess makes sense. And then finally, the graph on the right-hand side there, again, this is work out of Purdue, is looking at So this is a generalized linear model looking at BALF neutrophils, so in other words, neutrophils, inflammatory cells within the airway in relation to dust exposure, respirable particle exposures. And again, we can see this as a dose-dependent response there.
So do you think that equine asthma is a term that is easier for horse owners to understand, and that there is a degree of severity where you can have a moderate form of the disease that can progress than the previous terms RAO and IAD?
Yeah, certainly at the moment, the distinction between the diseases is largely related to severity, although there is one school of thought which is yet to be definitively shown that a proportion of horses that get the mild to moderate form of the disease then may go on in later life to develop the severe form of the disease. And there's some evidence to back that up. But again, it's not as simple as that. If we look at the prevalence of the mild to moderate form of the disease, anything between 40 and 80%, depending on how you define it, but also also dependent on the cohort of horses that you're investigating. Some types of horses are more inclined to get it than others. For example, young racing thoroughbreds, standardbreds, it's more common. Sports horses that are continually stabled, again, it's prevalent. So it's difficult to define. But when you look at prevalence in that group of horses and you look at prevalence of the severe form of the disease, not all of them by any means go on to develop the severe form. Going back to your question about ease of understanding of the term, then yes, I absolutely do. I think most people are aware of the term asthma. They would know the minimal kind of inclusion criteria, how you would define that disease. The relationship with exposures is well understood. I would say the one thing is there's an assumption with the use of the term asthma that we assume it's an allergic disease, and that's not necessarily always the case as we think about allergies.
Okay, so can you explain how you differentiate between the mild to moderate and the severe asthma? Mm-hmm.
I'll just highlight that in this slide. This slide here actually is just, again, a pictorial kind of representation of what I was saying with regard to the fact that all horses are susceptible to a dusty environment. So I think the old school of thought was that we had a proportion of horses that were non-susceptible and a proportion of horses that were susceptible. In other words, are severe equine asthma cases previously referred to as COPD, recurrent airway obstruction, heaves. But the reality is that there seems to be a continuum, a spectrum of responsiveness to that dusty environment, which again makes sense. And somewhere along that spectrum is where you would have that cutoff between the mild to moderate and the severe form of the disease. Okay, so this slide shows a table. This is taken from the revised consensus statement. And as we can see there, there's a lot of similarities between the two different forms of the disease. So generally speaking, the severe form of the disease will affect horses, kind of middle-aged horses and beyond. Any age can be affected with the mild to moderate form. Both of them have coughing. The effect on performance really relates to the severity of airway obstruction. Mm-hmm. So horses with severe airway obstruction, yes, clearly there's going to be effect on performance, but more so there's going to be effect on that horse's ability to just breathe at rest. And that's really where the main distinction comes, is that, I guess, either subjective or in some cases semi-quantitative assessment of their breathing difficulty, I think is what makes the distinction between the two forms of the disease. Everything else kind of follows on from that, with one exception, the exception being the effector cell that we see within the airway. So we know that the severe form of the disease is defined by an influx of airway neutrophils, whereas the mild to moderate form of the disease can be characterized either by neutrophilia or a mast cell influx or an eosinophil influx or a combination, any combination of those three. So other than disease severity, cytological profile within the airway would be the other way that you might make a distinction between the two forms of the disease.
Mm-hmm. Do you think that the prevalence of the different forms has changed during the time you worked in equine medicine, and why?
Yeah, absolutely. My impression certainly is over the last 20 years working in this disease, 30 years working, as a vet, then we're seeing a lot less cases bearing in mind we're a secondary or a tertiary referral institute that we see in the equine hospital at the university than we saw 20 years ago by far. And I think that probably, well, almost definitely comes down to an awareness of the role of the environment in inducing this disease. So oftentimes those horses have already gone through numerous management changes before we see them. So on a personal level, working in that kind of clinic, we see a lot less cases of the severe form of the disease. We probably see more of the mild to moderate form of the disease now than we've ever done, because again, I think there's an increasing awareness of the role of airway inflammation on affecting performance. So those horses might come in for poor performance or occasional coughing, and they come up for a full workup, including a musculoskeletal evaluation, upper airway evaluation, possibly even cardiac evaluation. Part of that workup would be looking at the airways. So I think the prevalence overall probably hasn't changed, but the prevalence that the vets see probably has changed, yeah. Okay, so the main distinction really between the mild to moderate and the severe form of the disease really comes down to the severity of airway obstruction. And this next video highlights that fact. So the image on the top left there clearly shows an airway that's severely obstructed. So I think the important thing to remember here is that we often think about bronchospasm, sort of smooth muscle contraction around these lower airways to be contributing. It absolutely does contribute to the airway obstruction, but there's other factors as well that contribute. So we have peribronchiolar inflammation there, we've got a degree of remodeling there, and we have this big plug of mucus within the airway. So that, on top of the bronchospasm, all contributes to a severely compromised airway caliber. And that's going on globally, really, within the lung with this disease. This isn't a focal disease, this is a diffuse disease. And therefore, the horse has more trouble breathing out than it does breathing in, and they have put an extra effort into to exhaling, and that's highlighted in this video here. And this is a kind of moderate degree of dyspnea in a horse. We can see that abdominal effort that is going on during exhalation. So we have a prolongation of exhalation relative to inhalation and a real effort pushing that air out there. And again, if this gets much more severe than that, or is more chronic than that with regard to duration, then I think there is a welfare aspect there as well.
Yes, and there is no doubt that this horse has a significant decrease of performance. But what about the mild to moderate cases?
Yeah.
How significant an impact does equine asthma have?
Well, there is evidence there, both from experimental settings, but also from observational studies that have demonstrated that there is an impact. So one could argue that a horse having airway neutrophils in response to a dusty environment is an absolutely appropriate immunological response to that kind of exposure. And the same if we went into a dusty environment, one would expect we would get airway inflammation as well. But the question being, does it impact on performance? There is evidence to show that is indeed the case. So this is probably the most recent evidence of that coming out of the group in Purdue, where they were looking at, again, a generalized estimating equation model looking at performance in relation to airway inflammatory cells. And this depicts two inflammatory cells, the mast cell and the neutrophil collected from bowel fluid. So again, reflecting what's going on in the lower airways. And we can see there, as the ratio of those mast cell increases or those neutrophils increase within the airway, the speed figures come down for those horses. So it does, and these are horses that were exercising. They were horses in work that were exercising and performing as one would hope they would perform. So it clearly has an impact, yeah.
So it's obvious in the horses that are in racing, but I suppose we would see the same in, for instance, show jumpers, that we can see a decrease in performance in these horses as well.
Yeah.
It's just not measured.
It's not measured. I think a lot of that is poorly understood. But when we look back at the previous slide showing the mucus within the lower airways, then the impact is going to be on gas exchange, and that gas exchange is dependent on delivering oxygenated air to the alveoli. And if one scopes a horse and sees a lot of mucus within the trachea, within the large airways, then that's really reflective of what's going on in the smaller airways. So intuitively, then there should be an impact in performance. With regard to those sports horses, then I think there's a little bit more work needs to be done with regard to how much of an impact that has. Yeah.
Definitely. There's a form of equine asthma that we haven't talked about, and that is summer pasture-associated asthma.
Yes.
It's very prevalent in some parts of the US, for instance, but do we see it in the UK or northern part of Europe as well?
Yeah, we do see that form of the disease, certainly in the UK, that we would see maybe 1 or 2 cases a year of summer pasture-associated asthma, but nothing like as prevalent is in the southern states. And most of the interesting work on that disease has come from the southern United States. But as you said, it's a disease that, as far as we're aware, has an absolutely identical phenotype to the organic dust-induced disease that we're more familiar with. The difference being that the inciting exposures are clearly different. This work that I'm presenting in this slide here, this came out from Costa et al. A number of years ago now, and this was looking at associations between periods of exacerbation in those horses and different exposures. And they found certainly there was an association with temperature in the summer months, with humidity as well, and these are very humid environments in the southern states in the summer months. But also an apparent association with exposure to molds, which was interesting at pasture. So again, it may well be that we know that molds play a big role in the organic dust induced form of the disease, and it may well be this is just a different population of molds, and a little bit of an association with pollens as well, but perhaps not as much as we often think there is.
Yes.
Yeah.
So now we're talking about dust. We need to talk a little bit about the environment because it plays a big role in the development of asthma.
Yes.
So what is the role of the environment?
Well, again, when it comes down to the horses that get an inflammatory response when they're housed or stabled, then we're really talking about organic dust. Okay, so that's dust that they would tend to be exposed to, that the source of which is usually forage. Not always, but usually forage. And when we look at that dust, and this is a slide just depicting respirable dust particles or very, very small dust particles that would be inhaled deep down into the lung in a horse. And when you look at what's in that dust, and there's many, many components that all have potential pro-inflammatory effects. And the ones that most work has been done on is the molds. So again, mold contamination of hay or straw. The mold spores are very small spores in the respirable range in the majority of cases, that when they become aerosolized, when the hay is disturbed or whatever, then they can quite easily be inhaled down into the airways. And we were aware of the role that molds have in the severe form of the disease, and possibly in some of the mild to moderate forms of the disease as well. And the other component that we've been interested in, particularly work that we did in Edinburgh a number of years ago, was looking at the role of endotoxin. And endotoxin is a component of dust that is well known to contribute towards organic dust-induced disease in humans working in grain stores, pig and poultry units, etc. And certainly with the severe form of the disease, it does contribute to the inflammatory response. There seems to be a synergistic relationship between the pro-inflammatory effect of endotoxin and molds. And with the non-severe equine asthma cases, so in other words, if we take healthy horses and expose them to dust and then remove the endotoxin from the dust, then the depletion in the inflammatory response that we see in those horses, you could almost predict by their response to endotoxin. So I think those two components are the ones that we're most interested in. And then people have probably read publications referring to beta-D-glucan, which in itself can have pro-inflammatory effects, but oftentimes it's used as a surrogate marker, if you like, of mold exposure. So there's many things in the dust that can potentially play a role. But the reality is, when we want to do something about it, almost irrespective of which component within the dust is causing the problem in that horse, if we get rid of the dust, we'll get rid of all of those components. Yeah.
Okay. So is there actually an easy way to measure the quality of the environment? And can you use this to measure improvement as well?
Yes, there are a number of ways in which the environment the airborne environment can be measured. I think the most common one, and again, probably underutilized, is just using our eyes. Intuitively, you'll walk into some stables and you will identify certain management practices or storage or forage, that kind of thing, that you would predict could have a significant influence on the exposures those horses are experiencing. Then the next step would be to try and quantify that in a more objective fashion. And that can be done in a number of different ways, and there's a number of different considerations one would make when quantifying dust exposures. Now, the first one is depicted on the images on the left-hand side there. So this is measuring dust exposures in horses within what we call their breathing zone. So that zone around their nose, around their nostrils, which is more reflective of actually what they're breathing in. And this graph on the right-hand side depicts this really nicely. Now, this is work that's quite old now from the group in Michigan, but very, very relevant. And in this particular case, they were looking at two different stabling systems, so stable C and stable R here. So system C was a hay and straw environment. But what I want to point out in this was that they were measuring from the breathing zone of horses, both respirable and total dust, in the hatched columns there, so here and here, and they were also measuring remote sampling. So in other words, somewhere else in the stall, the sampler was placed. And we can see that the breathing zone levels are much, much higher around where the horse is, actually inhaling dust. So if we wanted to measure in an objective fashion, then that would be the ideal way to do it. The next consideration would be what we measure. So do we measure respirable dust or do we measure total dust? This image in the center here is just one example of a number of different units that might be used to measure respirable dust. So this works on a kind of cyclone system, very similar to sort of modern day vacuum cleaners, and particularly measures or collects that respirable dust onto a little filter. Now, when we're talking about in practice or people trying to assess dust exposures in their stabling facilities, then this is maybe a little bit of a bridge too far to collect, because when one collects onto filters, then one has to be able to measure the mass of that filter before and after collecting, and that requires pretty specialized, accurate equipment. So the next option, which is being increasingly adopted or being used now, is to use these real-time monitors, and they come with a variable price depending on how many functions they actually have. But what they allow us to do is, as well as give us an overall level of dust exposure within the horses, they allow us to see peaks during the working day that might result in a marked elevation in exposures. For example, this is some work by Fleming and colleagues a number of years ago, where they were looking at different bedding types in horses throughout a working day or throughout a 24-hour period, and then these peaks were identified throughout that period, and the magnitude of those peaks clearly depended on the bedding type that was used, but more importantly, it was associated with certain activities within the stable. So in this particular case, the horses were out, the stable work was done, and often sweeping is the key one here. So we maybe have to think twice about whether we sweep the yard. It might look really clean at the end of the sweeping, but ultimately what we've succeeded in doing is creating an aerosol of dust. So I think the personal samplers, the real-time samplers are probably the way to go. They can be used, and we have used them to measure exposures in the breathing zone of horses, but oftentimes if you're just looking at management change, then just using these for remote sampling, placed in a suitable part of the environment would be sufficient.
So you can use this for your talking paper with the horse owner, the barn owner, to really figure out what is causing the problems.
Yes, exactly. You can make that association, and the other part of your question was the impact of change. And I think oftentimes, particularly with the mild to moderate form of the disease, that we said, yes, there's an effect in performance, and that effect can be quite subtle. And the more subtle something is, the harder it is for somebody to assess a change in what they're doing. So often putting a number on things, I think, will increase compliance with the particular change that's been recommended. So if one can generate a number and say this was the dust level before you made that change, this is the dust level afterwards, then that's often the only way that they can see it.
That it's working.
That it's working.
What we're doing is actually having an effect.
Exactly.
Yes. Seeing it black and white on paper. So how do we go about diagnosing equine asthma?
Okay. So again, we've got the different forms of the disease, bearing in mind that we said there was a spectrum of severities. Then if we deal, first of all, with severe equine asthma, then the history is really important. So that horse would need to have a history of exposures that you feel are capable of inducing that particular disease in that horse. And oftentimes they have exposure to hay or straw, but not always. Sometimes the neighbouring horse has exposures that are affecting that particular horse. So the history is important. Chronicity is important. Oftentimes those horses will have either a long history of breathing difficulties or a frequent history of recurrent episodes over time. So that's important. With regard to the clinical phenotype, again, it really comes down to this apparent increased effort at rest. So when you look at those horses breathing at rest, then you can see, like we saw in the video, an increased effort during expiration. And then further diagnostics would be really geared towards gathering information that supports that diagnosis. So looking for excess mucus within the airways and looking for the kind of classic increase in neutrophils in the BAL fluid. But it's interesting when we compare to human asthma that, yes, there are cytological investigations that are done in human asthma on induced sputum samples, but generally speaking, the minimal inclusion criteria in those cases really comes down to lung function. The problem we have in horses is that when you look at lung function evaluation in humans, there are often voluntary manoeuvres that are requested, whereas in horses we can't ask a horse to breathe out quickly over a period of time. So they're less sensitive than the methods that are used in humans. But yeah, the cytology is important because it adds to that list of criteria that are consistent with your diagnosis. With regard to the mild to moderate form of the disease, as we've already said, looking at those horses at rest, there is no apparent increased respiratory effort, otherwise it would fall into the other category. There's often a reduction in performance. Chronic coughing would be important, but with regard to investigating those horses, again, it comes down to confirming that they have airway inflammation. So looking for mucus down the airways and then looking for the cytological profile in the bowel fluid.
Yes. I see that in your diagnostic workup, you have endoscopy.
Yes.
So what do you do if you don't have access to an endoscope? Okay,
if you don't have an endoscope, then it certainly doesn't prevent one from collecting fluids from the lower airways. So I personally, partly for convenience, but also partly to allow me to assess the mucus within the trachea of those horses, to look at the carina, look for swelling there in the carina. I personally tend to take a sample from the trachea, evaluate the trachea, visually, and then use the scope to take my BAL sample, but that's not the only way to do it. And in fact, many people, perhaps even most people, would use a bowel catheter. So a bowel catheter is depicted on the image on the left there, and this is passed blindly down into the airways until it achieves a wedge within the airway. Most of them now will have a cuff on them, so the cuff is inflated. You're isolating a segment of lung. You're infusing your fluid, your saline or your PBS, into the lung, withdrawing that, and then that fluid will contain inflammatory cells. So that can be done blindly without the need for endoscopy.
Mm-hmm. So when you have your lab results from the bell,
yes,
you don't use these to measure improvement of the horse. So because they decline very slowly, mm-hmm. even after treatment. Mm-hmm. So what do you think about weighted clinical score as a tool to measure improvement in the horse?
Yeah, you're absolutely right, and you make a very good point there, Charlotte, that although we've said that looking at cytology, if we deal with severe equine asthma, the cytological profile, so the percentage of neutrophils in your airway, is an important diagnostic criteria, and one that is commonly used, but there's certainly evidence out there to show that it's not an appropriate means by which to measure at least short-term response to treatment, so that whether that treatment be anti-inflammatory medication or whether it be a change in environment or both, oftentimes those horses will show an improvement in lung function and yet a very slow or non-existent in the short term improvement in airway neutrophils. So it wouldn't be the best way of assessing the immediate response to treatment. So it comes on to your question about clinical scoring. So clearly lung function equipment in horses or equipment used to evaluate lung function in horses can be quite cumbersome. As we've said, not very accurate compared to human medicine, but certainly we can get some good readings from those horses, and oftentimes it's far from portable. So it's not something that would translate easily into practice, particularly ambulatory practice. And then one has to weigh up the costs of that versus how many cases they're going to apply that to. So the next best thing really would be having a scoring system that is semi-quantitative but correlates well to lung function. Now this slide here shows a recent publication, again out of Montreal, looking at the efficacy of cyclesinide inhalation in horses. But the reason I put this slide up was because it shows it quite nicely, the scoring system that was used in this study. So the graph here on the top is looking at lung resistance. So the higher that number, the more resistance and the more heavy those horses are. And then we can see a drop in resistance with the administration of the drug. And then it comes back again once that administration has stopped. But the graph on the lower left here is showing a weighted clinical score. So this was a scoring system largely based on one that had already been published. But again, we can see the pattern of response in those horses it mirrors quite nicely the change in lung function. And then importantly in that paper, again, this is the first time I've seen this to this extent, was looking at a correlation between lung resistance and that weighted clinical score. And we can see there's a pretty good correlation there between the two, that in that particular study, they then went on to utilize that information to subcategorize the horses into severe, moderate, and mild airway obstruction. Because we know, a horse with a lung resistance of 2.5, we know how heavy that horse looks, and then it's a case of transpiring that or translating that into a number that's derived from a scoring system. So it's not exclusively based on heaviness, it's based on a number of factors like auscultation, et cetera, as well. So yeah, I think it's underutilized in one aspect of our evaluation of those cases that perhaps we could be a little bit better at, myself included.
Okay, so now we've diagnosed the horse with equine asthma, and it's time to consider treatment. So which treatment options are there, and what are the pros and cons of these treatments?
Okay. So if we think about the pathogenesis of the disease, or the etiopathogenesis of the disease, as we know, the disease occurs where we have exposure to dust particles. I guess the exception would be the summer pasture disease, but certainly environmental exposures. Certainly with severe equine asthma, a susceptible population of horses. So we know that horses that go on to develop severe equine asthma have an inherent susceptibility to that through a number of different pathways, and there's a degree of heritability there, etc. And then this results in inflammation in the lung, and that inflammation then leads to other problems like hyperreactivity, mucus accumulation, bronchospasm, bronchial narrowing, a variety of different things that all originate from that inflammation. So when we talk about treatment in those cases, we really intuitively have three options. One is we reduce the exposures where at all possible, thus preventing the development of that inflammation. Another one, theoretically, is to alter the susceptibility of the horse, and that's something that really we're not in a position to consider at the moment. So it only leaves the other option of reducing inflammation within the airway. Other options as well would be to address the consequences of that inflammatory response. A good example of that would be bronchoconstriction. So the use of bronchodilators to bronchodilate those horses. But ultimately, when we think about the fact that bronchoconstriction has originated from the inflammatory response within the lung, then anti-inflammatory drugs really would be the mainstay of our drug therapy in those horses. With regard to pros and cons, if we're dealing with environmental control, that would be the gold standard, really. It would be the cornerstone of treatment or management of horses with equine asthma, either the severe or the mild to moderate form of the disease. And with the exception of the summer pasture disease, then often turning those horses out to pasture is a clearly indicated. However, that's not always possible, depending on the circumstances on the yard, availability of land, time of year, etc. So oftentimes those horses have to be housed for at least some of the day. So these are a few slides here just showing the kind of things that might be considered. Again, this is looking at the study by Woods and colleagues from Michigan, and we already looked at this graph with regard to the difference between breathing zone and remote sampling in horses, but I'm using this graph now to highlight the difference between System C and System R. So all of those dust measurements, whether it's breathing zone or remote sampling, whether it's respirable dust or total dust, they all significantly reduce when that horse is changed from a hay and straw environment onto a pelleted feed and wood shaving environment. So just that simple change makes a significant difference to the exposures. Similarly, this is work that we did at Edinburgh a number of years ago now. Again, we had a horse on 4 different environments, and we compared between the two. And again, we're looking at breathing zone dust levels in this horse. So this would be a hay and straw environment here, moving from hay onto haylage, but keeping the horse on straw made a significant drop, resulted in a significant drop in respirable particle exposures. And then again, moving from straw and hay to shavings and hay, again a significant reduction, but not as much as we saw when we changed the feeding. So the feeding seems to be the main culprit with regard to those exposures, which makes sense because when the horse is inside and it's got hay in front of him, that's where he or she spends most of their day with their head buried in the hay. Mm-hmm. And then the optimal environment would be the shavings and haylage, so similar to the shavings and pelleted feed that Woods used in their study. Another consideration that we have to make, which we've alluded to earlier on, was changing one environment and the impact it has on another environment. So again, these were 2 stables, so we had stable 1 and stable 2 here, where we had a horse that was bedded on hay and straw in one stable, and the other stable was unbedded. So we were measuring dust levels in the stable where the horse was, plus the neighbouring stable that shared a common airspace. And as we can see there, so the horse was in box 1 here, it was bedded on hay and straw, so quite high levels of dust there, but also in the neighbouring stable, high levels also. And then when we moved that horse, as one would predict, onto haylage and shavings, then a reduction in the dust exposure in that horse, but also a significant reduction in the horse next door. So I think that's important when it comes down to looking at livery yards, etc., where one person invests a lot of money and time and effort changing their environment, but the horse next door is on a poor environment, and therefore it could have a significant impact on those other horses if they were susceptible. Alternative management changes that might be considered as well was soaking the hay. So this is, again, some work out of Edinburgh showing that dry hay compared to hay that had short-term immersion. So this is basically dunking the hay net just prior to feeding, and horses that had prolonged soaking of the hay net resulted in a considerable reduction in exposures. And then there's products out there, the commercial hay steamers that also result in a significant reduction in respirable particles in those horses.
How short is the short-term immersion?
The short-term immersion was literally immersed in water just for about a minute or so. Yeah. But the important thing there is that this was a loose hay net that was immersed. Mm-hmm. So it's not immersing a tightly packed bale, because if you immerse a tightly packed bale for any length of time, the water's never going to permeate down into the... And really the way this works is it just makes it wet and it makes the particles stick to, so when the horse is pulling the hay from the hay net, it's not creating this cloud of dust. And then really interesting study again out of Purdue here showed the significant impact of feeding hay from the ground versus feeding hay from a hay net. And again, a significant reduction. So this was with the hay net. These are dust levels that are depicted in the box and whiskers plot. So from a hay net to no hay net, a significant reduction in the exposures in those horses, again, presumably because they're not pulling it from the hay net and creating this cloud of exposure. So very, very simple things that can be done. And then finally, I've already alluded to this work by Fleming and colleagues, just looking at management practice throughout the working day that might significantly impact the exposures in those horses. So if you're going to sweep the yards, it's a good thing to do, but try and make sure the horses are out before you do it.
Yes, definitely.